All right, welcome everyone. Thank you for joining us today for our Data Submission 101 for 2024 Outpatient Award Achievement. Go ahead and get started. My name is Liz Montgomery, and I work closely with these programs as a data analyst on the outpatient quality team at the American Heart Association, and I'll be joined throughout the presentation today by my colleagues Allison Smith and Sarah O'Kane. Before we get started, I wanted to give review a few housekeeping items. First, please know that the meeting is being recorded and slides will be available after the presentation. You can enter questions live into the Q&A feature of Zoom and keep an eye on the chat for messages from the AHA and AMA team. We'll do our best to answer during the call, but please know that we'll have additional office hours throughout the data submission cycle to answer any and all questions. And we're also available via our Contact Us form and help desk. Additionally, we do have captioning and a transcript available, but you can turn that feature off if it's distracting for you using the hide subtitle option, or you can resize the captions to make them easier to read under subtitle settings. During our call today, we'll be sharing some initiative updates, highlight our 2023 award achievement. We'll be providing details and criteria on data submission. We'll also provide a quick high-level demo of submitting data in the platform, then provide resources and tips to further assist you after the webinar. All right. The American Heart Association is really excited. Oh, wait, I didn't go. I skipped over our agenda, didn't I? Whoops. Oh, no, I got it there. Sorry about that. Saw a little note. The American Heart Association, as I was saying, is really excited to share with you our brand new Outpace CVD brand for our outpatient initiatives. Our Outpatient CVD suite of outpatient programs provide targeted quality improvement to support and recognize your organization to improving outcomes of cardiovascular disease. This encompasses our familiar initiatives of Target BP, check change control cholesterol, and Target type 2 diabetes, and also includes other special initiatives, a patient-level registry pilot, and projects in the outpatient space. Outpace CVD also aims to provide tools and resources tailored to specifically to our outpatient partners and works to steward quality improvement through cohort-based, one-on-one, and self-driven mediums. In Outpace CVD, we continue to promote guideline updates and new scientific understanding, to use feedback from healthcare professionals to drive programmatic change, to advance equitable health outcomes and address social determinants of health, and to identify successes and challenges through recognition data like that provided in our data submission cycle for achievement awards. So if you haven't already, you'll begin to see Outpace CVD appear throughout our support materials, and we'll be delighted to roll out more information as it becomes available. We'll also have some initiative updates in the Target BP realm. So for that, I'll pass it over to my colleague, Allison Smith.
Thank you, Liz, and thank you everyone for being with us today. I'm Allison Smith. I'm a nurse and public health professional, and I serve as the program director for Target BP on behalf of the American Heart Association and the American Medical Association. I wanted to share with you a few updates. I think January represents certainly the start of the data submission season, so that we can recognize all of your efforts in 2023 with the data that you've begun submitting. And that's the reason why many of you joined us here today. But it's also the beginning of the next measurement year. The things that you do in 2024 will influence your awards in 2025. So AHA and AMA wanted to take this opportunity to express our ongoing commitment to your success and ensure that you're aware of all the support resources that are available to you in your quality improvement journeys and to improve blood pressure control. So to that end, we're adding a new informational and navigational resource to our website, an About Us page that helps to describe a little bit about the initiative. Many of you are familiar that we launched Target BP in 2017 as a national initiative in response to our country's high prevalence of uncontrolled blood pressure. And together we've committed to work with healthcare organizations like yours to advance equity and improve blood pressure control. We do that by leveraging AHA's guidelines and scientific statements and the AMA MAP framework, which helps care teams organize their approach to providing evidence-based care. That framework, as many of you know, includes measure accurately, act rapidly, and partner with patients. We also assist healthcare organizations in your quality improvement journeys through the resources available on Target BP, such as professional education programs and events, downloadable tools and resources, and patient education materials. And we also offer additional support through AHA and or through AMA in terms of quality improvement programs. And I'll say more about that in a minute. And as you well know, and again, the reason that you probably came today was to recognize healthcare organizations annually with our Achievement Awards by celebrating those who are committed to improvement, those who adopt evidence-based activities, and those who achieve high control rates. So more on that to come. On the next page, I just want to dive in a bit to the quality improvement options and supports available to you. Quality improvement is a journey. We recognize that healthcare organizations have dynamic needs and preferences and different capacities to prioritize or focus your hypertension control efforts. So we've outlined some specific options that you could pursue either alone or in combination that best meet the needs of your organization. So starting left to right, Target BP is a self-guided approach. Through our website, you can find practice assessment tools that look at your processes and outcomes, professional education resources to strengthen your team's knowledge and skills, many of which have continuing education credit, the tools and resources for practice improvement and patient education that are downloadable in many different languages, and of course, award achievement to submit your self-reported control rate and practice attestation data annually to earn awards and compare your performance to external benchmarks. In the center, I've tried to highlight that AHA's team is also positioned to meet you where you are with national connections and local insights and support your commitment to blood pressure control. That support includes, in addition to what's available through Target BP, additional AHA hypertension science resources that their team can help navigate with staff support, additional data insights and metrics through a broader AHA registry ecosystem where you can track your progress over time, uncover trends and benchmarks with other organizations. In addition, they offer one-on-one quality support to review your data and provide insights and facilitate quality improvement activities. They also provide peer-to-peer and group learning activities for a deeper dive into the evidence and opportunities to share challenges and solutions to practice issues, as well as have a facilitated QI staff support. And then lastly, but not least, certainly providing local connections with the community impact staff who facilitate sustainable changes, clinic to community linkages, and also connections to other local resources. On the right, I also want to highlight AMA's MAP Hypertension Quality Improvement Program. It provides a clear path to significant sustained improvement in blood pressure control, and the program has demonstrated results of 10 percentage point increases in blood pressure control rates in as few as 6 months, with sustained results at a year. And that support includes evidence-based approaches to implementation and action steps to help your care team determine which team-based approaches are best suited for the patient population you serve. They also provide data metrics through dashboards and reports to help track individual patient progress, as well as performance insights at the provider site and health system level. Their hypertension and QI experts can help collaborate with your multidisciplinary team that include clinical QI and implementation experts for peer-to-peer coaching. And lastly, also providing additional population health and focus on quality initiatives that could be tailored to your institution's improvement and performance priorities. So in each of these, you'll see on a new About Us webpage that's coming any moment now, the ability to sort of click through and learn more and connect with, through the Target BP website to the AHA team, to the AMA team to learn more about these options. So stay tuned. That will be available shortly. And I also would encourage you, if you're not already receiving the Target BP newsletter, to do so, because all these updates are constantly coming through that monthly e-publication. And I encourage everybody on your care team, not just your leaders, to subscribe, because there's lots for everyone, whether they're clinically focused, quality improvement focused, or data focused. We invite all comers. So with that, I want to turn next to my colleague, Sarah, who's going to touch on the history of award achievement.
Thank you very much, Allison. Hello, everybody. I'm Sarah O'Kane. I'm a Senior Product Development Manager over our outpatient initiatives at the American Heart Association. And so I just wanted to touch on really quick the history of our outpatient initiatives in case you are new to our outpatient programs, and just wanted to outline that they've been around for several years, and in our most recent year we gave awards to more than 1,800 healthcare practices, with many of those organizations achieving gold status, which is determined by their high performance rate on one or more of the relevant measures for each initiative. And so, it covers several million patients all over the country, and we're really proud of all the work that is done within your local communities to help each individual practice achieve these awards, and then be celebrated for all of your work. And then on the next slide, this graph kind of gives you an idea of the growth of the outpatient awards programs since inception. And as word of mouth grows, and as the staff that we have committed on the ground working with your health practices, they recruit more and more organizations to participate and improve their care and get recognized. We have just kind of added more and more organizations to that list every year. And it's worth noting that the organizations who have achieved gold or gold plus has also been growing, particularly from 2021 to 2023. And then the next slide is around check change control cholesterol, which is our initiative focused on ASCVD, lipid management, and appropriate statin therapy, which has a little bit slower growth compared to Target BP, but this is a committed cohort of sites, and we're really working with them to move their performance rate to achieve gold by achieving appropriate statin therapy among their patients with ASCVD. And then the final slide in our history is around Target Type 2 diabetes, which is our initiative focused on type 2 diabetes and related comorbidities such as kidney health. And this is a rapidly growing program. And so we are really focused on growing this initiative so that we can move more organizations to better controlling HbA1c levels in type 2 diabetes patients. So you can see that over time, the program only started in 2020, but it's continued to steadily grow each year, and we're able to recognize more and more organizations each year, and we're hoping to recognize more this year. And then we wanted to pause before we continue and do a quick poll for everyone, just to kind of get a landscape of who's participating today. Is your healthcare organization a first-time data submitter in 2024? Are you a repeat submitter coming back? Or are you new, just attending this webinar for someone else? Who knows? Unsure. If you could answer the poll, that would really help us just kind of figure out who's here with us today. And then when we're ready, I will pass it back to Liz.
All right, I'm just going to go ahead and share the results. So it looks like we have 66% of our participants today are repeat submitters, and the rest either fall into that unsure or first-time data submitter category. So thank you for sharing that with us today. It helps us kind of know who's joining us, and really excited to welcome, I think it was something like 20-30% of new participants to the programs this year. So now we're going to go ahead and get into the details of eligibility, timeline, etc. And we're going to start with our timeline. So right now you can submit, edit, and revise your data in our online data platform. The deadline for the data entry is Friday, May 17th at 11:59 p.m. Eastern Time. So please note that the time zone is Eastern Time. It's not going to be 11:59 p.m. everywhere. Data is captured at exactly midnight Eastern Time, 1 minute after the deadline, to determine award status for all sites. So if you take one note during this call, please make it be that May 17th deadline. Next, the AHA and AMA will be reviewing and validating the data submitted to classify awardees by award level. You might hear from us during that time, so keep an eye out for communications from our team and your local team. And this will mostly be in June, but this might be if we have any questions about your submission, and your response will help us to confirm your appropriate award level. Then during the fall, we will notify 2024 awardees with your congratulations email and toolkit, and celebrate your accomplishments on our program websites. The recognition doesn't end there. We'll follow those with additional highlights of awardees at scientific sessions and in a published national ad. Throughout the presentation, we'll be emphasizing our suggestion to submit data early, and being on this call today is a great start. The reason for this is that we want to make sure that we can provide you with the best support available when troubleshooting any errors. This might be a confusing question that you need support in answering, or it might be a technical issue uploading your data. And as you can see here, we tend to get the vast majority of our data submissions in the final month, and our team is supporting nearly 20% of data submissions on the final day the last 2 years. So our team's going to do the best we can to help you get your data in on time whenever you submit, but if you do submit earlier, we're going to be able to be a bit more hands-on because we have the greater capacity to do so. Moving along, let's talk a little bit more about the benefits of receiving an achievement award. We'll be providing a national awards listing on our websites, and you can see the 2023 award winners now up until the 2024 ones are congratulated. We also send a national press release, acknowledge award winners at the prestigious scientific sessions, provide regional opportunities as well to share success, and we run an ad in Modern Healthcare Magazine in November for Gold and Gold Plus awardees. For your own promotions, we'll provide an award certificate, digital award icons, and a comprehensive toolkit that will help your marketing teams send a press release, social media messaging, email signatures, and several more items. It's very comprehensive. As we dig in, let's start by sharing who is going to be eligible for these awards. We have a pretty broad range of organizations that participate, but the fundamental criteria is that your healthcare organization, as registered and submitting data, must directly diagnose and manage patients with these chronic disease conditions. This means your organization must be prescribing and managing the medications of patients with these conditions. It also means that if you're primarily a screen and refer organization, you would not be eligible for the award, but our quality improvement tools and resources remain freely available to everyone. This is just around the award criteria. There are 2 steps to submit data for recognition. The first step is to register. This enables us to create a profile and user login for you in the data platform. If your organization is new to submitting data, please go to heart.org/register-my-outpatient org to register. If you've submitted before and already have a profile for the programs you'd like to participate in, you do not need to re-register. You can just skip straight to entering data, which we'll cover next. On our registration form, we'll ask you some basic demographic questions and, importantly, what initiatives you wish to register for. You can register for all 3 simultaneously, and if you're considering doing that, I encourage you to select them all. If you do decide to just register for one and want to add additional programs later on, you will need to complete the form again, so just starting with all 3 will save you a little time. Note that one registration equates to one potential award. So if you want your health system and each of its individual locations to be listed individually and each receive a certificate, then you'll need to submit registration forms for each of them. If you have 5 or more sites that you're wanting to register, there is a multi-site submission process in that same registration link that will save you a little bit of time. The second step is to submit data, and you'll start by logging into our data platform, which is aha.infosarioregistry.com, and then you'll navigate to Program Forms, hit Add New, enter 2023 because you're entering data from calendar year 2023. Then you'll just fill in all the fields, check the data entry complete checkbox, and then click Save and Exit. And you can save and return to revise your data up till the May 17th deadline. So we'll go into a little bit more detail on what that looks like, but this is the highest level, step 1, step 2. That's how you do it. And now let's talk about the data that you'll be submitting. Some of that data will be identical across program forms and can be copied and pasted from one form to another. So Target BP, check change control cholesterol, and Target type 2 diabetes will all ask for your total adult patient population, a breakdown of that total population by race and ethnicity, a breakdown of that total population by the patient's primary payer, and your total number of providers. The race and ethnicity table is a simplified version of Table 3B from the HRSA Uniform Data System reporting requirements for 2023 health center data. From their updated guide, we have one minor adjustment on the table this year, as Hispanic or Latinx was changed to Hispanic, Latino, Latina, or Spanish origin. And to get further into initiative-specific details, I am going to again pass it to Allison.
Thank you very much, Liz. We keep diving a little deeper each step here. So I want to just quickly review the available award levels for Target BP to start out with. They are the same as they were in 2023. So there are 4 different award levels. The first for participants who submit their data for the first time to demonstrate their commitment to blood pressure control. Silver for those attesting to at least 4 out of 6 evidence-based activities for measuring accurately. Gold for those reporting blood pressure control rates of 70% or higher, and Gold Plus for those who both attest to at least 4 out of 6 evidence-based activities for measurement and achieve a control rate of 70% or higher. On the next slide, I'll dive in just a little bit to the actual reporting requirements. So essentially, we use MIPS 236, the Controlling High Blood Pressure measure, national measure, and you provide for us a numerator and a denominator to calculate that control rate. The denominator includes patients 18 to 85 who have had a visit during the calendar year 2023 and a diagnosis of essential hypertension either before 2023 or in the first 6 months of 2023. The numerator for the measure is of those patients who have, had a visit during and a diagnosis during those times, who have their blood pressure controlled to a level of less than 140 over less than 90. The table below provides just a little bit more detail and some scenarios to think about of who to include or exclude from the denominator. So for example, if you have a patient who had a visit in March of 2023 and a diagnosis in March of 2023, they would be included in your denominator. If you had a patient who was diagnosed and had a visit in October of 2023, they would not be included because it was in the latter half of that year. And then another scenario would be a patient who had a visit in October of 2023, but their diagnosis was made the year prior, in November of 2022, for example. They would be included. And so those are the sort of general specifications for reporting your blood pressure control rate. We also ask you to attest to 6 evidence-based blood pressure activities that will contribute toward your award achievement. So if we'll go to the next slide, we've sort of outlined what those are. These are the same as we have used for the last 3 years now. So these attestation questions, essentially, again, you'll be asked yes, no, or unsure. You have to complete one of those answers to complete your data submission. But the affirmative answers are obviously the ones that will contribute toward achieving 4 out of 6 of those criteria. The first 2 questions relate to device accuracy. Do you calibrate your devices according to the type of device they are? Do you check to see if they're validated? The second 2 questions address your team. Are you training and testing them every 6 to 12 months to ensure their blood pressure measurement skills are up to snuff? And the last 2 questions are really about systems of care. Have you adopted a protocol for confirmatory measurements that you repeat either in office, use self-measured blood pressure, or 24-hour ambulatory blood pressure monitoring? And do you use a job aid like an infographic to encourage proper preparation and positioning? We encourage you to use to achieve all 6 of these, but you need 4 out of 6 to qualify for silver or gold plus award status. So since we added these criteria about 3 years ago, 3 data submission cycles ago, I should say, we have seen notable improvements in the adoption of evidence-based practices. And that inspired us to expand the attestation questions. So and on the next slide, you'll see an overview of the other pillars where you will encounter attestation questions this year. But just take a deep breath. These new questions will not have any bearing on your award achievement levels this year. This is a dry run year that will allow you the opportunity to get familiar with those questions, assess where you are from a baseline standpoint, and begin to think about what improvements or changes that you might make to improve your award eligibility for next year. So again, no changes to the measure accurately attestation questions. You will see these other categories of questions, and Liz will show you later where they will appear in the platform. But again, they will not have a bearing on your award status this year. On the next slide, just as a reminder, we did announce these new attestation questions and this expansion in a webinar last July. There's a recording of that available on the website. There's an extensive overview document that speaks to the clinical significance of these questions, the scientific rationale for them, the evidence base, a host of resources to help you achieve them, and then the sort of detailed descriptions of those questions. So that, again, is available on the website. Next month, we're going to have a deeper dive into this in terms of the questions and your questions and more about those attestation questions in the data submission next month. So I hope that you can join us for that event. And then on the next slide, just sort of a preview at a high level of what those questions will involve. So 6 new questions across the 4 new pillars that will really speak to the standards of care that you're setting in your institution that are evidence-based, the degree to which you assess whether you're actually following your standard of care, and some very critical clinical elements of each. So for example, do you have a treatment algorithm? Do you check to see if your team is actually following it? And does it include elements such as a treatment goal for less than 130/80 for patients with confirmed hypertension and known CVD, or a 10-year ASCVD risk of 10% or higher? Does it include an intensification prompt if a patient is net goal to add a medication class? Do you have other medication adherence strategies built into your algorithm? And do you prompt follow-up for patients who are not yet at their treatment goal? So that's just a snapshot of the Act Rapidly. And that pattern kind of carries itself out across these other pillars of setting a standard of care, checking to see if your team is adhering to it, and what are some of the specific elements based on the guideline to help drive improved blood pressure control. So with that, I will turn it to Sarah, I believe, to talk us through some of the award achievement and details for the other programs.
Thank you very much, Allison. All right, so moving on to check, change, control cholesterol. The award criteria for this initiative is unchanged from prior years. So participant status is achieved simply by submitting complete data, committing to improving your risk assessment of ASCVD, and then by implementing ASCVD risk calculations in your clinical workflows to the best of your ability. And then gold status recognizes the practices that have achieved everything per participant, as well as achieving greater than or equal to 70% of your patient population with statin therapy. Per the MIPS number 438 measure, which is statin therapy for the management of cardiovascular disease. And on the next slide, we'll go a little bit deeper into the actual measure criteria. So this one is focused on patients meeting any of 3 risk groups. And there is a note here just to call out that there have been a few minor adjustments to the criteria for those risk groups since last year. So even if you're a recurring submitter, just double check when you're submitting to make sure that you're accommodating those tweaks. And then it's effectively looking at patients who are at risk for cardiovascular disease, and then looking to see if they have been prescribed a statin at some point during the measurement period, or if they're already taking a statin. Then we have a couple of additional kind of attestation questions around ASCVD risk scoring, but those are just kind of yes/no questions with some additional follow-ups. And then on the next slide, here's the details on the actual denominator risk groups. Don't have to read through this whole slide, but the core of this is it's focusing on patients with either clinical ASCVD, high LDL or hypercholesterolemia, or diabetes. And the measure does need to include patients from all of these groups. It's not like you can just pick one of the 3 for your denominator. It has to be patients who meet any of these groupings. And I'll call out that HEDIS has a similar measure focused solely on that first group of patients with just clinical ASCVD. But that is technically not equivalent to this measure and would not meet the requirements for cholesterol award achievement. So if you have any questions or any doubt on whether your organization's built-in measures will work for submission for this awards achievement, then don't hesitate to reach out. You can always submit a contact us request with questions, or you can reach out to your AHA representative. And then the next few slides are around our Target Type 2 Diabetes initiative. And for award achievement in this initiative, the criteria has remained unchanged from prior years. So still just have to submit complete data and commit to improving. And then to achieve gold, you have to achieve the appropriate thresholds listed below on at least the first measure, and then you have to achieve the appropriate threshold for one of the 2 below measures. And on the next slide, we'll go more in depth on the actual criteria for the core measure for type 2 diabetes, which is the hemoglobin A1C port control measure, which really hasn't changed from prior years. That measure is the same as what you've submitted in the past if you're coming back. It's focused on patients who have a diagnosis of diabetes. Technically, it's not just type 2 diabetes. It could be any type of diabetes. And then checking to see if their most recent hemoglobin A1C level in 2023 is greater than 9%, or they didn't get one at all. If you take nothing away from the Target Type 2 Diabetes program, the one thing to take away is that this is an inverse measure. So we are measuring how many patients are not doing well, how many patients have a high hemoglobin A1C level, or they didn't get a checkup basically in 2023. So for this one, just make sure, if it seems like your total is ending up really high, it might be that you swapped the criteria, because we're looking for a low performance percentage on this one to achieve gold. I think it's gonna be less than or equal to 25%. And then of the other two measures that you're required to submit, on the next slide, we just require you to submit one or both of the measures that exist for the Target BP program and the Check Change Control Cholesterol Initiative. And so you don't have to submit both. You could pick whichever one you have data for, whichever one is higher. It's up to you. But to achieve gold, you must achieve a greater than or equal to 70% threshold for one or both of these measures. So this initiative for award achievement does require meeting a measure minimum for at least two measures. So key takeaways, just to kind of, there's a lot of information being thrown at you, but things we will want you to remember after the webinar ends and you remember nothing else. The deadline to submit data for 2024 Achievement Awards is May 17th at 11:59 p.m. Eastern time. So if you are Pacific time or, Hawaii time or earlier, you just keep in mind that your deadline may be earlier in the evening. And then if you have submitted data before, do you need to re-register? No, you can just log into your existing account and start submitting data. And if you need a password reset or anything like that, feel free to reach out, but you shouldn't need to re-register unless you are trying to submit for a new initiative. And then last but not least, the new Target BP pillar attestation questions that Allison went through, those, there's a lot of questions. Answer them to the best of your ability. They do not affect your award status for this year. So you do have to complete them, but your answers will not impact what award you achieve. So with that, I will pass it back to Liz.
Thanks. Before I move forward, I did want to give a quick reminder that this is being recorded and both the slides and recording will be available and sent to all registrants and awardees. But now I'm going to do a quick walkthrough of what submitting data looks like in the actual platform. If you're interested in a deeper dive, those will be highlighted in the resources section and available online. The first step to submitting data is logging in at aharegistry.com/login. If it's been a while since you've logged in and you've forgotten your password, you can use the forgot password link to, if you've set up your challenge questions and it'll prompt you to provide the answers, or you can use the need help options. For accounts that have been deactivated over time due to how much time has passed between logins, you can also contact your local AHA representative or use our contact us form for help, and AHA staff are always happy to help you with any user account questions. Now that you're logged in, you'll see one of two views. If you're submitting data for multiple locations and have access to all of them in the platform, you'll be given the option to select which location you would like to access first. This will bring you to the community page. If you're only submitting data and only have access to one location, this is what you'll see first in the platform. On the top right of the community page, you'll find our navigation tips to help you know where to go in case it's been a minute since you attended this call. Also point to our library, which has a number of the helpful resources that we'll be highlighting soon. You'll submit your data using our program forms, and you can navigate there either by clicking the icon under Get Started or by clicking the link in the left navigation bar. And that's where we're going to navigate to next. So under program forms, you're going to see two sections. Under Edit Forms at the bottom, you'll be able to see any forms you have previously opened in previous data submission cycles. And then under Add Forms at the top, you'll see all the programs you are currently registered for. So if you've only registered for Target BP, that's all that you would see in that top section. You'll click Add New next to the desired program. This demo is going to be on Target BP, so I would click Add New next to that program. You'll be prompted to enter a reporting year. So remember that 2024 awards are based on 2023 data. So I would hit 2023 and then hit Submit to progress. And this will bring you to the program form itself. Each form begins with detailed written instructions in the body text of the form. To the right, you'll see the tab section. You'll need to answer all questions to be eligible for an award, so you'll want to make sure to complete all 3 tabs. And we recommend that you save frequently as you go, as the form does not save automatically. So don't forget to save your work. So scrolling down the form, the first 2 questions for Target BP both require a yes for award eligibility. The first asks if your organization diagnoses and manages hypertension up to and including prescribing and managing medications. And the second asks just for you to confirm that you're a designated representative and are attesting that the questions are accurate to the best of your knowledge. Question 3 asks for your total adult patient population. So remember to be prepared to further break down this number by race and ethnicity as well as by payer group. And then questions 4 and 5 are the denominator and numerator questions that are based on MIPS 236. This will determine your blood pressure control rate and affects your award status. So be sure to enter whole numbers only, don't include any commas. On each program form, there will be a question for that breakdown by race and ethnicity, which is question 8 for Target BP, and for payer group, which is question 9 for Target BP. And you can see that those are tables and they will auto-calculate at the bottom to a number that should be identical to question 3. The second and the third tab house our attestation questions that Allison walked us through earlier. These include all questions under the Measure Accurately, Act Rapidly, Partner with Patients, SMBP, and Equitable Health Outcomes pillars. So remember that you must answer each question. However, only Measure Accurately attestations will affect your award status in 2024. Finally, once all answers have been completed, return to the first tab, which is the Facility Information tab, and click the Data Entry Complete checkbox. I'll just note that if this checkbox cannot be populated, it means that your data is incomplete and you may not be eligible for recognition. So if you cannot click it after you've completed everything, go back through all of the tabs and make sure that no fields are left unanswered before exiting. So usually it's just one was missed as you went through filling it out, and then you'll be able to return, click the checkbox, and then click Save and Exit. Submitting data for check change control cholesterol and target type 2 diabetes follow a very similar process. So you'll return to the program forms and then you'll click Add New next to the desired program and follow the same steps to open the program form and then make sure to navigate through all of the tabs to complete your submission. And for resources and tips, I'll go ahead and pass it back to Sarah.
All right, thank you very much, Liz. Let me just pull up the slides really fast. So we have a couple of great data submission resources available for you, focused just kind of around the technical aspect of data submission to walk you through all the steps that you need to submit data for an award. We have a quick user guide, which is kind of like a screenshot version of what Liz just did with the demo, where it walks you through step by step all the places you have to click within the online platform to submit data. There are 2 sets of demonstration videos, one focused on navigating the data platform, and then one focused on how to submit data. And so the navigating the data platform one is great to just kind of get you familiar. That one pretty much stays the same year after year. And then the how to submit data videos, we currently only have the videos that showcase data submission from last year, but because we're working on the 2024 updated versions. However, the old versions still pretty much hold up. It's the same navigation from last year. The questions have just changed slightly, mostly for target BP, but cholesterol and diabetes are pretty much the same. So you're welcome to still access those. And if you want to go to the next slide, then here are our written resources around data submission. We have data collection worksheets, which are really useful to figure out what are the questions you need to answer. And it also has a lot of nice kind of fine print in there to answer questions you might have about what counts for a particular field, any nuance that you might be wondering. Those instructions are included within those data collection worksheets. And then in case you have additional questions, we tried to address most things that have come up in our FAQ documents. And then last but not least, we have our evidence-based BP activities, resources, and examples, and a clinical practice resource guide for target type 2 diabetes. The first one is focused on those attestation questions, the existing measure accurately ones that we have, as well as the additional 24 questions for act rapidly, partner with patients, self-measured blood pressure, and health equity. So that is still in the works, but it will give additional kind of like scientific guidelines, resources around how to achieve those activities, and it will give examples of like what counts for yes or no if you're not sure based on how the question is worded. So that will be coming soon. And then for diabetes, because we have questions around cardioprotective anti-hyperglycemic agents, as well as kidney health, this guide gives you links to other diabetes and kidney health specific resources in case you need help with those questions. All right, and then so as far as the data uploader goes, if you are interested in uploading data for multiple sites, then we have specific resources around our self-service data uploader. And so this allows you to basically type in your data for achievement awards into an Excel spreadsheet and then drag and drop it into the platform versus manually typing into the form for every single one of your organizations. So it's not publicly accessible, like we don't have all the resources downloadable on the website, but if you are interested, feel free to submit a request through that bit.ly/AQ contact us link at the bottom, or reach out to your local AHA representative and they can connect you with all the templates and the instructions for how to use this uploader tool. And we have several office hours coming up as well, since we have added so many new questions to Target BP, and I'm sure we're going to have, there's going to be lots of questions from our organizations about what counts, what doesn't, how can we best achieve these things, tips. And so we will have a webinar around that on February 21st. And feel free to register online whenever you can. And then we will have 2 subsequent office hours around data submission for award achievement, one in March and then one in May. So keep those in mind, pencil those in, particularly the May one, because that may be the last chance that you have to get any major questions answered before the May 17th deadline. So key takeaways, register your new organizations early. When you're entering your data, do it as early as you can. You're entering data through end of 2023, so it should be readily available now, especially if you're working on UDS submission. And then we have plenty of written resources as well as demo videos for you to access. And then for when you're actually typing in your data submission into the online platform, the way to make sure that your data is complete and you haven't missed any fields is the data entry complete checkbox. If you can check that box, then it means that you've entered every field that's required for award achievement. And then again, there's our bit.ly/AQ contact us link. I think we had a couple of questions come in through the Q&A feature that we can get to, and don't hesitate to reach out for password resets, etc., to our IQVIA support desk.
Thanks, Sarah and Liz, for walking us through all that. We do have a few minutes here for questions, I believe. Shall we dive in? I'll dive in with one that came up a few times, and I will dive in more deeply if you join me next month on the office hours about the attestation questions. But I think the 140/90 and the 130/80 numbers caught that sort of difference, caught the eyes of a few of you. And I just took a high level explanation of the difference is that the 140/90 is the threshold used by the National Performance Measure that's set externally, external to AJ and AMA, and it is the threshold used to define control for the purpose of a performance measure and the award achievement. When the numbers 130/80 came up, it was in the context of the attestation criteria that Liz put up here on the screen. And we're asking if your treatment algorithm has less than 130/80 stated as the treatment goal. And that's for an individual patient, again, who has had confirmed diagnosis of hypertension, known CVD, or 10-year ASCVD event risk of 10% or higher. And so one is a performance goal set by an external agency. One is a treatment goal as defined by the guideline. And we're really looking to see if it's stated in your guideline. We're not looking at performance measures at that threshold at this point. So we can talk more about that on the follow-up webinar or office hours next month. So were there other questions that you guys wanted to touch on that we were frequently asked or yet unanswered?
Yeah, I can call out really quick. I put it in the chat, but we did have a couple of questions about the electronic clinical quality measure equivalence or ECQM equivalence of the MIPS measures that we require for the award submission. And so even though we didn't put the IDs in the slides, I put them in the chat. There's CMS ECQM equivalents for all three of the measures. They should be identical specifications. So if you have one built in already, or if you want to build an electronic measure and you want to use the CMS specs, then they're the same. And I put the IDs in the chat, and we can always send them out in the notes after the call.
And you may have just said this, Sarah, but just in case I was typing an answer, we do have that included at the top of each data collection worksheet, what the equivalent ECQMs are.
Yeah, and I think we answered a lot of questions in the chat. However, someone said they lost sound, but let's see.
I see a couple of questions around submitting as multiple sites. So I'll just share a quick answer to that, which is it's up to you how you'd like to submit for your organization. So we've seen an increase in organizations who are, like, for an example, an FQHC system with 5+ different clinic locations, and they've decided to submit data for each of those locations so they can contrast and compare how they are doing, both on the measures or on different attestation activities. And each of those clinics can then receive an award. But we also recognize that some sites are not as well prepared to enter that detailed breakdown at the race and ethnicity level or at the payer group level, and so they then choose to submit just for that one system, or they could do both, submit for the system and at the site level. And it's really up to you what would work best for your organization. But if you do have a lot of sites, then our staff have a lot of resources to help make that easier for you using the uploader tool that Sarah highlighted earlier. Just so you don't have to go into the program form for each, you can, populate a CSV file and upload it. But if you only have one or two sites, the program form is so much faster than going through the CSV file.
Thanks, Liz. And just to clarify too, we all are members of the national team, and many of you have relationships in your local communities with AHA community impact staff who are also a resource. And together, we want to support all organizations exploring their options and figuring out what submission approach works best for you. Do we submit for one of our sites or clinics or the whole system, or some of them? And that evolves over time, and every organization has a different preference and appetite for that. So we're happy to help you think through that and find the path of least resistance and greatest efficiency to get that done. So we're grateful for all your efforts to submit your data. We're grateful for all of your quality improvement and care efforts to drive the outcomes that we're all seeking through this. So any other questions or comments that you guys want to make, or shall we move to our wrap up?
I think that I'm good moving to the wrap up. Just keep an eye out for emails from your local AHA staff with new resources as they become available. And as Allison highlighted earlier, our newsletters are always a great resource for those additional support options and quality improvement options as well.
Well, I just want to thank you all for your time and your effort to be here today with us and learn more about the options available to you and the resources. And please be in touch with any questions or comments that you do have. Any other last words from Sarah or Liz? No? All right. Well, thank you, everyone. Thank you for your commitment to improving cardiovascular disease wellness, and best wishes. And I think we'll see you again, hopefully next month on future webinars and office hours to support your efforts between now and the magical May 17th. Thank you.
Thank you all so much.